Good evening, ladies and gentlemen. I am back. It is me. It is I am him, Noah Greenspan. And I'm back tonight to answer a question from my Facebook group, which is a very important question and a very common question that is asked. So I'm going to take this opportunity to do a little mini webinar and answer this question. So here's the question. I get short of breath rather quickly, and I'm not sure if or how much I should push myself. If I do push myself, am I helping to strengthen my lungs, or am I doing more damage than good? Let's start with the fact that, as I say over and over and over again, breathing is a multifactorial process, okay? Meaning that there are many factors that can contribute to how well or how poorly we breathe. As an example, when you have an obstructive pulmonary disease like COPD or asthma, you have difficulty with the exhalation phase of breathing, meaning that you have difficulty blowing air out. So airway mechanics play a role. When you have a restrictive lung disease, an interstitial lung disease like idiopathic pulmonary fibrosis, okay, you have difficulty breathing air in, again, a mechanical problem. Now, you can be completely short of breath, but your oxygen can be perfectly fine, or you can be completely short of breath and your oxygen can be very low. The other thing is that there are some people whose oxygen is very low, yet when you ask them, they don't feel very short of breath. Okay, so that's one thing to keep in mind, is that there are many factors that influence breathing. Another factor, you just ate a giant meal. So I'll often hear people say, as an example, I don't understand what happened. I walked to the restaurant, I was doing fine. Coming home from the restaurant, I had to stop every half a block, or I had to take a taxi home or something like that. And the reason for that is because you now have an obstruction of the food in the stomach, restricting the diaphragm from contracting downward, okay, making it more difficult to breathe. Another thing, when you walk out in the cold weather, that can also cause your airways to narrow, making it more difficult for you to breathe. Being out of shape can make it more difficult for you to breathe. Being overweight, particularly in the abdominal region, can make it more difficult for you to breathe. So that being said, we have to evaluate what is really causing your shortness of breath. Next order of business, you asked, I'm not sure how hard I should push myself, okay? It's not your job to do that. It's the job of the rehab team, your doctors, to tell you what's okay and what's not okay. And when it comes to how hard you should push yourself, safety is always the #1 concern. As an example, at the Pulmonary Wellness and Rehabilitation Center, www.pulmonarywellness.com, we do every single exercise session under fully monitored conditions. And by that, what I mean is every patient is wearing an EKG the entire time they're exercising. We're checking your blood pressure every 5 minutes. We're checking your oxygen saturation every 5 minutes. And if you need oxygen, we're going to give you as much oxygen as you need to remain well saturated, meaning in the mid to high 90s, okay? Now you ask yourself, am I doing more damage than good? Okay, are you helping to strengthen your lungs, or are you doing more damage than good? So let's first talk about the fact that you can't strengthen the lungs themselves. Okay, the lungs are not muscles, so they're not going to be strengthened. The shortness of breath that you are experiencing while affected by your respiratory system is a reflection of the overall body conditioning and the overall body working as a whole. Now, how well or how poorly your body uses oxygen is based on 3 main factors. #1, how good are your lungs at moving air in and out of the lungs? Okay, how good are your lungs at moving air in and out? How good is your heart at pumping blood? And then how good are the peripheral muscles at using oxygen? Okay, so the question is, are you hurting yourself? You know, are you helping to strengthen your lungs, or are you doing more harm than good? That is a question that's impossible to answer, okay, because it's a specific question to you. So could you be hurting yourself? Absolutely. If you have heart disease, if you have hypertension, you have pulmonary hypertension that is uncontrolled, then maybe you could be hurting yourself, okay? But being somewhat short of breath is not necessarily something that should be avoided at all costs. In fact, you kind of have to get short of breath if you're going to get any benefit from the exercise program. Now, I mentioned before the monitoring that we do. And there are several different factors that come into play with determining how hard or how vigorously should somebody exercise. And these are the things that I think about when, when we're looking to determine an exercise program for somebody. So when it comes to heart rate and rhythm, okay, as a general rule, again, anything I'm about to say needs to be cleared with your physician for you. Okay, these are general rules, what we do at the Pulmonary Wellness and Rehabilitation Center, and we also modify these as necessary for each individual patient based upon their individual medical problems, medical conditions, medications they take, how they're feeling that day, blah, 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 blah. So let's start with heart rate and rhythm, okay? In general, okay, the heart rate that we allow people to go to as a maximum, okay, during the workout is 200 minus their age. Okay, why do we do that? Okay, most people will consider a maximum heart rate 220 minus your age, okay, but for us, by making it 200 minus your age, we're actually building in a little bit more of a safety zone there, okay? But the other thing is that a lot of times target heart rates are set, okay? Understand that when we do 220 or 200 minus your age, okay, we're setting a theoretical heart rate, okay? A theoretical maximum heart rate off of which we will base a theoretical workout heart rate. However, when it comes to respiratory disease, it's a little bit different because the things that will stop a person with pulmonary disease from exercising are different than, let's say, the person who has a heart problem or even the healthy person. Whereas we may see what we call a cardiovascular or hemodynamic endpoint, meaning they reach their age predicted maximum heart rate. In respiratory disease, the person is often stopped long before they reach these hemodynamic endpoints because they're too short of breath and or their legs are too tired to continue, or whatever body part they're using to work out is too tired to continue, okay? So those are things to keep in mind, but as a general rule, we will allow somebody to go up to 200 minus their age is the rate. And of course, we're looking at the rhythm, okay? We're looking at the EKG to also make sure that everything is stable with them. As far as blood pressure, how high do we let people go? For our patients that are 80 or above, okay, and that's a lot of them, okay, we will allow them to go to a maximum systolic blood pressure of 180 millimeters of mercury. Now again, this is assuming they don't have pulmonary hypertension. Again, this is assuming they don't have coronary artery disease, assuming they don't have severe aortic stenosis. There's a whole bunch of factors that go into our decisions of what's okay and what's not okay for people. But you have to understand that basically I'm giving you general rules that you can talk to your doctor about and say, would this be okay or would this not be okay? Okay? Now, for our patients who are under 80, as a maximum, now this is not what we're shooting for, okay? What I'm talking about though is at the peak of exercise, the maximum blood pressure we will let them go to is 200 millimeters of mercury as a high systolic blood pressure. And again, that's not our goal, okay? That's for the patient working out most vigorously at the highest level of their exercise program. Now, if it turns out that that blood pressure is occurring at a lower level than we might expect it to, in other words, the blood pressure is high, disproportionate to the level of workout that they do, okay, that's something where I'm going to get on the phone and talk to their doctor and say, hey, your patient's blood pressure is 200 over 100 when they're basically walking at a very, very low intensity on the treadmill or doing a very low intensity on the UBE, blah, 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 blah. Okay, but again, every person has to be taken as an individual. And then again, the key with oxygen saturation is we want to keep people, I like to keep people 92 to 93 as a minimum, okay? And we will give people absolutely as much oxygen as it takes to get them to that level. Because as opposed to certain programs where they will lower the workload in order to keep the person's oxygen saturation okay, that makes absolutely no sense. And the reason for that is, think of it like this. If your everyday life requires you to be this fit, and I work you out at this level down here, okay, which a lot of programs will do because they believe that low intensity, long duration workout is the way to exercise patients with cardiovascular and pulmonary disease, but it's not. This makes no sense because remember, if this is what your life requires and I exercise you down here, you can do that till the cows come home, but that doesn't mean that your life gets any better. Now, if I give you as much oxygen as you need, okay, and remember that your life requires this, but with oxygen, even if it's 15 liters per minute on a mask, even if it's 100% oxygen, and I can work you out up here, guess what, people? Your life gets better, okay? So keep that in mind as well. Again, I'm about to answer your question. So again, everybody is different, which is why when we see a patient for the first time, or when I see a patient for the first time, first of all, I will grill you, okay? I will turn the lights on you. I will ask you where you were when Kennedy was shot. Were you on the grassy knoll? I will ask you every single possible thing about your medical condition, past, present, future. Future is a little more difficult, okay? But I want to make sure that I am not going to be surprised by something where you say, you know, oh yeah, I forgot to tell you I had a quadruple bypass 2 years ago, or 10 years ago, or 15 years ago, okay? So I will start my interview by giving somebody an opportunity to tell me everything they want to tell me about their medical history, and then I will go through with them their medications, and I will ask them question by question by question by question all the medical conditions that I worry about when it comes to risk stratification. And by risk stratification, I mean that there are certain things that I worry about because they're the most dangerous during exercise. And these are what they are. There's 3 things that worry me most, okay? One of them is what we call coronary insufficiency or coronary artery disease or atherosclerosis, okay? Because these things can lead to a myocardial infarction under the wrong circumstances. The next thing that I think about is arrhythmia, okay? So that is the reasoning behind our EKG. When we first opened our program 18 years ago, there were people who said, oh my God, what do you need an EKG for? You're not dealing with cardiac patients, you're dealing with pulmonary patients. Well, let me tell you something. In about 95% of the cases where I've had to intervene on behalf of a patient, okay, it's always been the EKG that gives me a hint that something is about to go wrong, okay? There's a saying that says some people make things happen, some people wait for things to happen, and some people wait for things to happen, some people make things happen, and some people say, what happened, okay? Well, I'm not gonna wait for my patient to have an emergency and treat it if I can be aware of things way back down the hill and I can prevent that emergency, okay? So that's the second thing. So I talked about coronary insufficiency, arrhythmia, and finally congestive heart failure or pump failure, okay? And that can be either left-sided or right-sided. So these are things that I really need to assess very carefully and make sure that I am in communication with the patients, not just their pulmonologist, but their internist, their cardiologist, to know, do we as a team really understand this patient's medical history? Do we know what the risks are? Do we know that we can exercise them safely? Next order of business, as a general rule, okay, I don't want people exercising to 100% of their max, and in your post you mentioned you got dizzy, you felt short of breath, they had to stop you and put you in a chair. I would say that's too much, okay? But now I'm going to introduce you to something that is widely used. It's called the RPE, or Rate of Perceived Exertion Scale, okay? And what this is, there's 2 different types of scales. One of them, it's also called the Borg scale, named after the person who invented it, okay? But we call it an RPE scale, and then I'm going to talk about a perceived dyspnea or breathlessness scale. So there's 2 versions of this scale. One goes from 1 to 10, the other goes from 6 to 20. And the reason why I prefer the one that goes to 6 to 20 is because this makes perfect sense. if you understand why it goes from 6 to 20, okay? So in this scale right here, 6 and 7 correlate to very, very light, meaning that you're working very, very light. 8 and 9 correlate to very light. 10, 11, 12 are fairly light. 13, 14 are somewhat hard. 15, 16 are hard. 17, 18 are very hard, and 19, 20 are very, very hard. So this was made primarily using 20-year-old subjects, okay, as their test crew. And if you remember that I told you that the original estimated heart rate for people age predicted is 220 minus your age. So if you think about it, okay, somebody who's 20 years old, if we take 220 minus their age, then their theoretical max heart rate is 200, which correlates to 20, which correlates to very, very hard. Sitting and doing nothing, okay, they're at 60, which would be very, very light. Okay, so it goes, if you think of this as going a heart rate from 60 to 200, that's how this was basically come up with. So now here's the simplest moment you've been waiting for. How hard should you work out? Okay, when you do a workout, you should think of it like a flight. Okay, if you're sitting on the runway and all of a sudden your pilot decides, we're gonna go like this, that is not going to be very comfortable for people. And same thing, if you're flying at cruising altitude and your pilot decides, we're going to go like this, that's not going to be very comfortable for people, okay? So think of it like this. When you first begin your workout, okay, you want to be working in the fairly light range, okay? You want to get your body warmed up, okay? Another thing to consider is that the first few minutes of exercise are the least efficient time of exercise, okay? During those first few minutes of exercise, your body, the muscles, the joints, the tendons, but also the cardiovascular and pulmonary system are their least efficient. So it's at these times that you should be working out in the very light to fairly light range, okay? Or the very, very light, start off very, very light, work into very light, work into fairly light, okay? Then we're ready to go to the next stage. And if you think of a treadmill workout, this is what we're gonna do. We're gonna go in graduated stages. The majority of your workout, and I'm gonna post this for you under this video, okay, in the comment section. The majority of your workout should be in the somewhat hard to hard range, okay? It should be in the hard range at the peak of exercise. If you're working out very hard or very, very hard, that is too hard, okay? So again, think of it like this. Your workout begins. You're in the very light range, okay? Or the very, very light range. As you start to get your bearings, as you start to feel a little bit better, as your lungs start to loosen up and your airways start to open up a little bit, you work into the fairly light range. Then you go into the somewhat hard range, and the majority of your workout should be in the somewhat hard range. So think of somewhat hard as cruising altitude, okay? Now we're getting to the end of the flight, and the pilot may have a connection that he needs to meet. So only for those last few minutes are you gonna work into the hard range. He's gonna push it a little bit, and then we're gonna start the cool down. And again, remember, you don't wanna go from working out in the somewhat hard to hard range to nothing, okay? So again, you have several weeks till pulmonary rehab. Start walking, okay? Number one, I love these activity trackers. Hello to my Fitbit group, okay? This is a great thing because then you can actually count. How many steps did you take each day, okay? And there are cheap ones, there are expensive ones. You don't have to get the most expensive one on the block, but this gives you a way to track exactly what you do. So I would say this. You have to get a starting point, okay? And again, assuming that you're gonna begin an exercise program, everything that we're talking about should be cleared by your physician. Doc, am I safe to exercise? And if doc says, I don't know, maybe there should be some testing. Maybe you need a stress test, okay? In order to find out, are you safe? Because again, we don't like surprises. We don't want you to have a heart attack. We don't want coronary insufficiency. We don't want arrhythmia. We don't want congestive heart failure, okay? Those are the things that are gonna get you in trouble, okay? And if you have risk factors for any of those, things like age, obesity, sedentary lifestyle, high blood pressure, high cholesterol, diabetes, high stress, blah, 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 you are at a greater risk of having a cardiac event, okay? So again, to summarize, okay, how hard should you be working? Your workout should start out nice and easy, okay? Work out in the very light to the fairly light range, okay? As you start to feel more comfortable, work into the somewhat hard range, which is where most of your workout should take place. Then you get up to the hard range at the very, very peak. And then once you feel like you've done your time at the hard range, which should only be a couple of minutes, maybe anywhere from 1.5 to 3 minutes in the hard range, okay, you start to gradually back it off. Remember a flight, okay? You want a nice smooth flight, a nice gradual takeoff, nice smooth air at cruising altitude, nice gradual cool down, okay? I hope that answers this question. Any questions you have, post them right here. Discuss, my people. Good night.